Hello, my name is Lacey Swack, and I'm going to be discussing my Social Work 683 school assessment and intervention project. So today we're going to be focusing on Stephen, a 7-year-old Caucasian boy who has a history of uncontrollable rage and defiant behavior at school, especially in the classroom. He was referred to a social worker for these behaviors. And currently, he lives with his father and grandmother, and he has overnight visitation with his mother twice a week and every other weekend. Stephen has been reported as arriving at school with a smile on his face while greeting teachers. Although Stephen's father was actively using illegal drugs and would experience psychotic breaks. While living with both of his parents, Stephen experienced a crisis when he was 5, which was witnessing his father beating his mother. This resulted in her being hospitalized, and his mother reported that there has been no law enforcement nor child protective services that have been involved. So, the presenting problem that Stephen exhibits is, as I said, defiant behavior and uncontrollable rage. His first grade teacher has a classroom behavioral system utilizing tallies. So students will receive tallies for bad behavior, undesired behavior, which results in lost privileges, such as recess or sitting with a friend during carpet time. His teacher has reported that he's often off task and leaves his center, which has resulted in losing the privilege of recess. So, due to this, Stephen turned to violent behavior, and it stated that he destroyed the classroom and was just throwing objects at teachers and peers because he was so upset that he lost recess. Um, some of the other stakeholders that are involved in this case are the teachers and the staff at his school that see these situations, as well as the healthcare professionals that were involved in both of those hospitalizations. Some of his support systems include his mom, his grandmother, and his social worker. So we're going to do a little reflection on cultural considerations. This family is white, but that's not the only thing that is to be considered. We also have to consider family dynamics. Um, so Stephen has been experiencing massive fits of rage, which have resulted in the violent outbursts. He's had a history of violent outbursts that affect others around him, including his teachers and peers. So that's one thing to reflect on. How is this affecting the people around him? How is this affecting his teachers, his peers that um, see this, one of their peers, hurting a teacher or their peers? That's has a long lasting effect on a child. Next, the family dynamics will shift as Stephen increases his anger. This could look like increased stress on his parents or his grandmother on his grandmother, as well as on his teachers. They could definitely be feeling sort of a loss of control with how he's been acting out in the classroom. I know that's got to have an effect on them. Also, if Stephen increases his anger, I feel like the his father could also be increasing that anger because he sees his son acting out, so he's more prone to, his emotions already aren't regulated, so he's probably already upset at his son for acting this way, or maybe he's doesn't care at all. Um, so some of the factors that would be included in this culturally responsive assessment would be, as the social worker, exuding cultural competency. So understanding each of the ethnicities that you serve, each of the racial backgrounds and ethnic backgrounds of the families that one serves. Also understanding direct and indirect racism. So, how microaggressions affect the children you serve, or how they affect the families you serve or the communities. I think it's also very smart to be aware of the gender roles and the family dynamics in that family. So um, I would be wondering, how does the dad treat the grandmother when they're in the home? Who does the cooking? Who does the cleaning? Who pays the bills? And what are those roles in the family that Stephen is seeing on a daily basis? And also exuding anti-racism, diversity, and inclusion and equity. Miss the E. Um, so this would look like actively resisting racism, racist policies, racist conversations. So there are a couple of standards and policies that will guide my practice with this family. First is self-determination of the NISW Code of Ethics, which states that social workers respect and promote the rights of clients to self-determination and assist clients in their efforts to identify and clarify their goals. Social workers may limit clients' rights to self determination when, in the social worker's professional judgment, the client's actions or potential actions pose a serious, foreseeable, and imminent risk to others or themselves. So, for example, if Stephen was to disclose to his social worker that he had a palpable plan that he was going to implement that would cause harm to his teachers, let's say if he missed recess again, then that social worker has an ethical decision to make on if they will report to the teacher that they foresee risk to the peers. In this case, as it states in 1.02, not just the client's actions, but potential actions. So if he is disclosing to the social worker that, hey, I have a plan to, if next time I miss recess, I'm gonna tear the classroom apart, then the social worker has a right to let the teacher know that she or he sees risk to others, especially the children. A policy that would guide this is the Family Educational and Privacy Act. FERPA deals with privacy, parental rights, and at age 18, students' rights to their records and an explanation of those records. So this act protects children and families' rights to privacy and confidentiality throughout their entire relationship with a social worker. And it also allows students, when they're 18, they are able to see those records and someone can explain to them those records. So there is one theory that I picked out that was pretty guiding in this analysis of Stephen and his family. The social learning theory is essentially an optimistic and strengths-based approach that assumes people are able to learn. The central approach within this as perspective is to provide effective learning opportunities that enable family members to learn and implement new coping skills. So for Stephen, after witnessing the abuse of his mom at the hands of his dad, he most likely mirrored those of his father's aggressive behaviors. And that was measured by the several outbreaks that were witnessed at school. However, the social learning theory tells us that people are able to learn. So, based on this, Stephen is able to learn new coping skills and learn how to regulate his emotions based on this theory. But he's also able to learn how to become aggressive and act quick on his feet due to his rage. On his rage. So I assessed his risk factors and protective factors. So his risk factors, excuse me, are his living situation, him moving, and his father experiencing psychotic episodes as well as violent behavior at school. So him living with his dad is a risk factor because he is seeing those aggressive behaviors in play each day. Um, and beginning to build on them, it seems that they just keep getting worse. It also stated in his case analysis or case summary that he had moved to a new school and was still showing up though every day with a smile on his face. So he's definitely experiencing maybe a little bit of a culture shock, and trying to make new friends. Maybe that's been a little tough. So I think that's the second risk factor that I assessed. Also, his father has experienced psychotic episodes in the past. Um, that is just something that is hard to live with, and especially as a child, which I feel like has resulted in his violent behavior at school. Um, some of the protective factors, like as I said, he appears friendly and comes to school with a smile on his face. Perhaps his mother um, adds to that, kind of causes that, because he spends time with his mother twice a week. Um, and he also lives with his grandmother, which is just, we don't know much about her right now, but the fact that he's not just living with his father, the fact that he does have a female figure in the house and maybe somebody that he's able to talk to, or if the dad's acting out, someone he can run to. Um, so some of these principles below are important in this assessment process. Again, assessing the risk factors and protective factors that are present within the family, and also identifying what could be changed. Um, to demonstrate respect for the clients, and also listening for their survival strategies, which is also tied into the social learning theory. Another thing to do in the process is help clients recognize their strengths. This ties back into the strengths perspective, and then also enabling the family members as partners in the change process. So, letting them know that they are able to work towards the goal, or they're able to work towards finalizing a goal as well. And they're also able to be in that process, seeing how the client and their family is changing. A couple of additional questions I would ask is, how does the family view these issues? How does the grandmother view this? What does the father view this as? I would also ask if the father has a present diagnosis. I know that um, if someone has schizophrenia, it could be likely passed down to their offspring. So I would be wondering what his diagnosis is, if there is present diagnosis. And also if there are barriers preventing family members from using the resources that they've been given so far. So I have a proposed school intervention for Stephen. Assuming that he has a diagnosis of post traumatic stress disorder, PTSD, given by a licensed psychiatrist and is currently on prescribed medication, which I know that takes a little bit to get there, but assuming that he is, Stephen should be placed in a resource room for support, which would prevent potential aggressive behaviors, as well as develop an individualized education program with the school social worker. This should call for Stephen to receive weekly counseling services, at least for an hour, from the social worker, as well as collaboration with the parent or grandmother. So, through these sessions, which CBT and social learning theory will be utilized, Stephen will reduce aggressive behaviors and build on his strengths and learn new coping skills. So, um, wrapping up, I would consider differential diagnosis for Stephen, such as ADHD or oppositional defiant disorder. Um, I would also try to use consistent positive reinforcement for him, and focus on his strengths. I think I could also definitely utilize a trauma informed approach with Stephen, and introduce him maybe to adverse childhood experiences survey. Um, and then also increasing the collaboration with his family. So I would be asking, why does Stephen reside with his father? and also collaborating with his treatment team. I think one challenge that I would experience is Stephen living with his father. Um, just when a child is in that environment, seeing those behaviors every day, and then also, and then in the afternoon, trying to change and like redo those behaviors that he's experiencing would be hard. I know that he's not able to, move out, but that would be a challenge for me personally, as well as my lack of experience with extremely harsh behavior and violent behavior. And then also just knowing that other kids are being put in danger at his school, which can cause bigger issues, knowing that other family systems are involved, and this could even involve the legal system. Somebody could say, well, he tore um, tore up all of my daughter's books, so I'm going to sue that family. That could get to that point. So I think I would have that in my mind as well. And these are my three references that I used. Thank you for listening. I hope you enjoyed. Thank you.